in private hospitals. So what you do is actually building trust and confidence of your patients in this increasing open and competitive market. So a standard is a tool for you to show that you are competent, to give patients confidence. And it's not actually everything. European standards, because we're so closely related to legislation, gives you legal certainty. It avoids legal disputes. It can show that you have done what you had to do. You were competent. And then lastly, it can be used, and I think this is very important, and I speak later on it, in the framework of certification, quality labeling. You will be able to show that you are competent through certification, through accreditation. So let's take a look. Such a standard on private hospital services, what does it contain? What could it contain? And I speak constantly in the word could, because today we don't do it yet. It could set the service level offered to your patient. It can facilitate, it can give a layout on the facility requirements, equipment requirements. It can speak about the education of your staff, ethical questions, quality management system, about a lot of things which you decide, because you are sitting around the table, you are writing the standard. And then about this certification, which I spoke about, accreditation. European standards are the benchmark for this accreditation, for the certification. It is taking place in several countries. For example, in the Netherlands, there are some private institutions who do certification. ZKN, Mr. Udo Matthijs is here present today. He can also give more further details about it. They certify hospitals that they are competent according to standards. You can make a European standard on it. But you can also do in the framework of the European hospitals the same thing. You can create an accreditation scheme, and those hospitals which fulfill these requirements can, for example, put on the European law, the logo of the European Union of the private hospitals. It is just an idea which I offer to you. Why? Commercial advantage. At the end, we're always speaking about money. It gives credibility, visibility to the patient that your hospital is competent, that you are able to provide a service. So a patient, instead of classically going to the famous countries for healthcare, they could also opt for Portugal, for example, because you deliver the same service. Credibility, visibility for the patient. You get new patients, you get new income, you get additional clients. So who is doing it today? Not the private hospitals, because at the end you decide, it's your choice, but these people have already chosen to do it. The chiropractors, European chiropractors have a problem that they have different habits, different education in different countries. So they say, we're going to lay down what we are doing at European level so that we have a fair competition, and that in some member states where today the quality level is very low, that we raise it to a certain level. Equal playing level field, equal competition, that is what we said at the very beginning, Mr. Leiden, opening, fair competition, freedom of choice. Hearing aid technicians, they have the same problem. There were hearing aid services offered in different countries at different prices, but what was the quality level? How could the patient have confidence? So we said, we're going to harmonize it at European level, raise the quality level of the countries which are not fulfilling minimal requirements, and we do it through European standards. Also the osteopaths, we are discussing with them, they're very much inclined to go the same route. And the aesthetic surgeons, plastic surgery, There is, for example, in my own country, in Belgium, quite a lot of private clinics set up by anybody, but occasionally accident happens, and they are not regulated. So there is a need to take a look at what goes on there. I spoke to you now a lot about standards for hospital services, but it's not only that what we do. We speak a lot about e-health innovation, and also that standardization is very much a reliable tool to create a new market which does not exist today. It is new business, new activities, so we are not there with 12,000 standards, it's a smaller set of standards. And I show you some of the things what we are doing, why we are doing it. First of all, it is beneficial of all. Patient and healthcare professionals get the benefit of it. It's beneficial for the economy, cost savings, it's beneficial for the society. Everybody has an advantage in it. So we have to do it. We have to facilitate access to the healthcare to all EU citizens, wherever they happen to work or travel. So how are we doing it? What are we, for example, already doing? The European Electronic Health Insurance Card. I'm pretty sure you heard about it. In the old days, we used to have, and maybe still some countries today, a paper copy of the famous E-111 form, where we went from one country to the other country, and when we needed healthcare services, we went with this paper copy to the service provider. Well, today we have transformed that paper copy into a standard, into a SEN workshop agreement. So we have specified the European Electronic Healthcare Insurance Card. We have also specified the coding of information and traceability of human tissues and cells. Very innovative. We needed to do it quickly. We did it together with the European authorities, the European Commission, and we have laid it down in a document which has the number 15,849. It's just newly published, brand new. There are the electronic health records. That is more difficult. That is at the moment going on. There are a lot of initiatives on different forms of platform at European level, international level, IEE, and so on. So the European Commission has mandated us, and we come to it now. The European Commission has mandated SEN, Senelec, and ETSI to look at it and to concentrate on the interoperability of the health record. It's a long-term process, well, long-term, it takes more time, which is taking place in two phases. The first phase is we have to elaborate a work program. What are we going to do? How are we going to do it? That has been done, that has been realized, and now we're starting up with the second phase, the agreement on the standards, the technical reports, and the guidance documents. It's a process which is taking place at this very moment, where important players, like one of our gold partners, are participating at. So, conclusion of my presentation, I would say two main conclusions. Consider elaborating your own European standard on the hospital services to effectively create fair competition, freedom of choice for your patient, because by doing so, he has a choice whether to go in one clinic, public or private, whether to go in one country, public or private. You do fair competition at a fair price, and the patient can compare the services of the hospitals. And when you have that, maybe you can consider accreditation, the certification scheme, the logo, and I put as example the one of the European Federation, to distinguish yourself, to show that you are such a competent hospital, that you are fulfilling the requirements, and that you can attract patients. And with that, Chairman, if you agree, I am ready for questions and answers at a later moment in time for you, and I want to conclude my contribution. Thank you.
Thank you very much, Guido. We leave the questions and answers to the